You ever get hit by a headline so sharp it cuts through your day? On June 29, 2025, one did just that. U.S. drug overdose deaths have dropped, but still remain alarmingly high. You froze. Coffee paused mid-sip and thought, wait, are we finally turning a corner or just catching our breath before the next wave? Let's sit down and talk it through. Not like a press briefing, more like neighbors catching up. No stats without stories, no charts without context, just real life, straight talk. Setting the scene, let's rewind to the end of 2024. The U.S. closed out the year with an estimated 80,400 overdose deaths. That's down significantly from a high 110,000 in 2023. A nearly 27% drop. Historical, no doubt. Places like Kentucky reported a 30% fall. Boulder County, Colorado, its lowest rate since before COVID. Progress. But let's not rush to celebrate, because 80,400 still means we lost about 220 people every single day. Nearly 10 people every hour. It's progress, but it's also grief, spaced out in hourly intervals. It's better, but not good enough. Where we are now, summer 2025. For the 12 months ending June 1st, 2025, the CDC's provisional data shows 82,138 overdose deaths nationwide. That's a 26% drop compared to the same period the year before. It's the lowest recorded total since 2020 or before the pandemic era changed everything. To follow the trend, from about 114,000 deaths in 2023, we dropped to 87,000 in 2024. Now, just over 82,000 in 2025, mid-2025. It's the right direction. But we're still talking about a national tragedy happening quietly, relentlessly. What's actually helping? 1. Fentanyl awareness and a surge in Narcan access. Fentanyl hasn't vanished. It remains the most lethal player on the field. But two things have made a major difference. Naloxone, Narcan, is everywhere now. Over-the-counter in pharmacies, stocked in libraries, available at community events, handed out in schools. Lives are being saved in backyards, fast food bathrooms, and bus stops. States got serious about harm reduction. Kentucky, New York, Wisconsin. Each poured funding into treatment, drug checking programs, and syringe exchange services. When people know what they're up against, and when they have tools, they can survive the encounter. 2. Mobile clinics and telehealth accessibility. What started during the pandemic stuck around. And thank goodness. Mobile treatment vans now bring medical help to people who live hours from the nearest clinic. Telehealth keeps mental health and addiction treatment accessible, even without transportation. Stigma drops. Access rises. 3. Smart use of settlement funds. The billions from pharmaceutical settlements didn't just disappear into bureaucratic black holes. Cities and counties used that money for boots-on-the-ground harm reduction, Narcan kits, needle exchanges, street outreach programs, and test strip distribution. 4. Federal border measures. On June 26, 2025, new visa restrictions aimed at curbing fentanyl smuggling went into effect. These measures are targeted at transnational trafficking networks. Too soon to measure their full impact, but the federal government is pushing harder on the supply side than ever before. What's still going wrong? Carfentanyl's return. Carfentanil, a cousin of fentanyl used in veterinary settings for large animals, is popping back up in toxicology reports. It's more potent and less predictable. And it's killing people who may not even know they've ingested it. Polysubstance poisonings, fentanyl's showing up where it doesn't belong. In cocaine, methamphetamine, benzodiazepines, even counterfeit Adderall. People who don't identify as opioid users are dying from opioids they didn't know they took. Funding instability, progress costs money. The CDC and SAMHSA are both facing potential federal budget cuts. Experts warn, if harm reduction funding dries up, so does the safety net. Gains we've made could vanish faster than they appeared. Regional and racial disparities progress isn't evenly distributed. States like Nevada and South Dakota have seen upticks in overdose deaths. Rural communities, Native American populations, and Black Americans continue to experience overdose death rates well above the national average. The crisis may look better on paper, but it doesn't look better everywhere. Meet Jasmine. Let's get personal. Jasmine is 27. She lives in Laredo, Texas. One Saturday in June, she started behaving strangely inside a pizza shop. Confused, sweating, collapsing. Someone nearby had Narcan. They used it. She survived. There's no big headline for Jasmine, but her story repeats again and again thanks to access, awareness, and fast action. She's not a data point. She's a life reclaimed. Notre Dame, where innovation meets impact. Kentucky's overdose deaths fell 30.2% in 2024, from 2020, down to 1,410. That's not a fluke. The state invested in every rung of the ladder: prevention, treatment, enforcement, and harm reduction. Governor Andy Beshear called it a watershed moment. Rightfully so. New York reported a 12.3% drop in overdose deaths by mid-2025. Mobile drug checking technology and expanded access to buprenorphine made a difference, especially in urban pockets, hit hard over the past 5 years. Boulder County, Colorado, smaller population. Massive progress. Boulder County reported the lowest overdose death rate since before COVID. The success? A combination of steady local funding, community buy-in, and years of consistent harm reduction. What June 29, 2025 tells us? It tells us that people are fighting back, and it's working. It tells us that policy, when aligned with public health, can save lives. It tells us that talking about overdose deaths is no longer taboo. But it also tells us this: 82,000 lives lost in a single year is not a success story. It's still a crisis. This is a fragile moment. Take your eye off the ball, cut a budget, lose a program, and we're right back to where we were in 2021 or worse. Dr. Force, your role in this story: 1. Carry Narcan. It's available at pharmacies. It's easy to use. It saves lives in seconds. 2. Talk about the issue. Silence helps no one. Share facts with your family. Ask questions. Break the stigma. 3. Fight for funding. Call your lawmakers. Send emails. Let them know this isn't the time to shrink support. 4. Get involved locally. Find a nearby harm reduction group. Donate, volunteer, spread the word. 5. Watch policy shifts. Stay informed about changes in state and federal law. Every line item matters. Where we're going, the mid-2025 numbers offer hope, but they aren't the finish line. They're a checkpoint. What happens in the next 6 months will matter just as much. If the federal government maintains funding and community programs stay alive, we could see further declines. But it will take all of us: voters, parents, educators, first responders, policymakers, to push that trend forward. Eyes are already on the CDC's next provisional data report for Q4 2025. That's the next marker on this road. It's June 29, 2025. The headlines say the numbers are down, but behind every statistic is a life. Jasmine, Jason, someone's sister, someone's dad. Progress isn't a moment, it's momentum, and momentum only lasts when we move together. Want to stay part of the story? Click subscribe to receive updates, stories, and tools that keep this momentum going. You're not just reading, you're showing up. And showing up changes everything.